over here and wash my hands. I'm Sierra. I'll be your nurse for today. We're going to be checking out your head, your ears, your eyes, your nose, and your throat today, okay?
Alright.
So I'm just going to ask you some questions, and then I'm going to assess you. So let's get started. Do you have any mouth problems such as tongue sores, mouth sores, lesions, redness, swelling, bleeding, pain? No?
Nope.
Okay. How about any sinus problems like pain when you push on it or postnasal drip, like your nose is running?
No, that's pretty good.
How about nose problems? Do you ever have any nosebleeds, stuffy nose, change in taste
Yeah.
or smell? Okay,
Sniffer's pretty good.
good. Do you have any previous problems with your mouth, throat, or nose, such as surgeries or treatment?
No, can't say I have, no.
Do you use nasal sprays?
No. Hate that stuff.
Okay. Do you have a history of tooth grinding?
No.
When was your last dental exam?
Last year?
Okay. It's important to do those yearly. Does your family have a history of oral, nasal, or sinus cancer?
No, I can't say that I'm aware of any.
Good. Tell me about your daily practice of oral care. How many times do you brush?
I brush my teeth in the morning.
Okay. And do you floss?
Maybe.
It's important to floss as well. Tell me about your usual diet, please.
Oh, whatever the little woman at home makes me, it's normally pretty healthy stuff.
Okay, good. Do you have a history of smoking?
No.
And do you use any alcohol?
Seldomly.
Okay,
On a celebration occasion.
good. That's good. Okay, and then moving on to your head, do you have any lumps or lesions on your head or neck that don't heal?
Nope, they're all pretty good.
Do you have difficulty moving your head or your neck ever?
Nope.
Do you have any facial or neck pain or frequent headaches?
No, can't say I do.
How about any dizziness, lightheadedness, or spinning sensation?
No.
Do you have any previous head or neck problems, such as surgery, medication, or physical therapy?
Nope, never had any surgery of any kind.
Pretty healthy guy. Do you have a family history of head or neck cancer?
No.
How about a family history of migraine headaches?
My mother and sister get migraines, depending on the year, but quite frequently.
Okay. And you said that you don't chew tobacco, so I'm not going to re-ask you that question. Do you wear a helmet or a hard hat if you're biking or in a construction area?
Rarely ever in construction area and never on a bike.
Okay. Tell me about your typical posture when you're sitting. Do you tend to slouch?
Am I slouching now?
Not too bad.
Yeah, I'm pretty good.
Okay. That can just cause tension headaches. How about your recreational activities?
I guess I'm pretty good. Can't really say there's any much difference.
Okay. Are you satisfied with your appearance?
I think I'm pretty cute.
Okay. And now we're moving on to your eyes. Do you have any recent changes in vision?
No.
Any spots or floaters in front of your eyes?
Yeah.
Little things you can see scooting around? How about blind spots, halos, or rings around lights?
Nope.
Do you have trouble seeing at night?
Nope.
Double vision?
No.
Eye pain?
Yep.
Any redness or swelling in your eyes?
No.
Do you have excessive watering or tearing or other discharge from your eyes?
No.
How about any previous eye problems, such as medication you've had to take, surgery, laser, or corrective lenses?
I had a piece of rust in my eye that was taken out, 2 months ago probably.
Okay.
Eye doctor said it healed to about 95% or so.
I'll make note of that. How about a family history of eye problems or vision loss?
My mother and sister wear contact lenses, that's about it.
Okay. And how about exposure to chemicals, fumes, smoke, or dust?
Probably.
Farmer, okay. And you said that you got rust in your eyes, so that was probably a flying spark from welding. Do you wear protective glasses?
Oh, yeah.
Okay, good.
Just one of them freak things.
Mm-hmm. And how about sunglasses?
Oh, I wear them every day.
Okay, good. Do you take any steroids, any cholesterol medicine, any mood medicine, like medicine for schizophrenia or depression?
Nope.
How about tuberculosis?
Nope.
Have you had any vision loss that has affected your ability to work or care for yourself and others?
No.
And your last eye exam, that must have been when you got that piece of rust in your eye?
Yep.
Okay. And you just have sunglasses, not
Mhm.
prescription.
That's correct.
Okay. And do you live or work around frequent loud noise?
Machinery when it's running, I guess.
Do you ever go swimming?
Seldomly.
Do you use any ear protection
No.
while you're swimming? Okay. Moving on to your ears. Do you have any recent changes in hearing?
Nope. I've been told I have selective hearing. That's about it.
How about ear discharge?
No.
Any ear pain?
Nope.
Ringing or crackling?
No.
Any previous ear or hearing problems, such as infections, trauma, or earaches?
Nope.
Does your family have a history of ear problems or hearing loss?
No.
And you said that you sometimes are around loud noises.
Mm-hmm.
And do you ever use ear protection while you're around the loud noise?
No, I never do because it's never for a long period of time, maybe 10 seconds or something.
Okay. And you don't really have any hearing loss, but your ears haven't affected how you care for yourself or others?
No.
Okay. Well, before I start assessing you, I have my Snellen chart here. So, if you can just tell me the letters that you can read to the lowest amount.
A-E-I-O-U.
Okay, thank you, sir. I'm going to perform the whisper test if you want to stand up. I'm just going to say a couple syllable word, see if you can hear it the same in both ears. Did you hear the same?
Yes, I did.
Okay, and while you're standing, if I had a tuning fork, I would do the Weber and Ryan test, and you would feel the vibrations in your ears, and you would feel it on your mandible. And then the balance test, if you want to close your eyes and put your hands at your side. Your balance looks good. Okay, you can sit back down, sir. Oh, sorry. Hit hands. Okay, so now I'm just going to first assess your ears. I'm going to inspect just the general shape, the consistency. Are they symmetrical? Do they have any profuse draining? They don't. So now with my otoscope, I'm going to look at the tympanic membrane of both ears. Note that it's not bulging or red or anything really bad like that. While I'm doing that, could you please bear down like you're trying to have a bowel movement? And I'm going to make sure that doesn't make either of them bulge anymore. Okay, good. It doesn't. And I did the whisper test. I did the Weber and Ryan test when you were standing. And I did the Romberg test. So I think your ears are good. And I did the Snellen chart while you were standing, so now we're going to move onto your eyes. First, I'm just going to look at them, the general look of your eyes. You don't have any drainage. I don't know any redness. Pupils are both equal. I have a pen light. I'm going to shine it in both your eyes to watch the reactiveness. Now I'm going to take his eyes through the 6 fields of vision. Follow my finger, please. Thank you, sir. Okay, did that. I'm going to cover your eye and watch how your eye moves independently. Okay, good. I'm looking at your eyelashes and your eyelids. Could you close your eyes, please? Good. No, I don't know any discharge. There's no unusual color. There's no unusual swelling. Your eyes look like they're well aligned in their sockets. Your sclera is nice and clear. The color is white. There's no eye pain, so I'm not going to evert your upper eyelid. Your lacrimal apparatus, I'm going to touch this here. Corneal reflex is present. When I palpated it, it feels normal. I already checked the transparency when I shine my light into your eyes. And I checked your pupillary reaction with my pen light as well. The pupil is iris in shape. The iris is brown. Shape is round. The pupil is also round. And then I did the accommodation as well with my pen light. At this point, I would use an ophthalmoscope and I would test for the red reflex, and it would be present. I would look at the optic disc at this time with my ophthalmoscope as well, both eyes. I see vessels. I note the sets, how many sets are, the color, the diameter, the arteriovenous ratio, and